Our goal is to change the way people respond to genetic disease susceptibility. We improve people's quality of lives, I think, at a high level because we give them accurate information which covers many things, and then we support them with that information. I got involved in this field because my sister had a kid with Down syndrome. The child died after 6 days, and it was a horrific thing for a family to go through. And I couldn't believe that that could happen in this century, that we could not know until the child was born. I think if we had known, the child's life would have probably been saved, actually. Our goal with the Panorama non-invasive prenatal test was to offer something that could be used earlier in the pregnancy than anyone else in the world, and also to offer better sensitivity and specificity and coverage than anyone else in the world. And we've really achieved that goal.
I am a maternal fetal medicine specialist and medical geneticist. We are offering Panorama to all high-risk patients. This is such a great screening test that has a high accuracy that they feel confident in knowing that once those results come back low risk, that their baby is most likely unaffected. This has been a great option for those patients who want additional information but don't want to take the risk of pregnancy loss that comes with invasive testing. Many of our advanced maternal age patients are quite worried about their pregnancies. With the ability to provide them a test that's non-invasive, that is a better screening test than what we currently have to offer, we've been able to give them some reassurance earlier on in the pregnancy. When we first began, all we had was maternal age as a screen for chromosome abnormalities, and that had a terrible detection rate of roughly 50%. Since NIPT has come on the market in really 2011, we've now been able to offer patients a screening test that has a greater than 99% detection rate. The risk of a microdeletion syndrome does not increase as the maternal age increases. And some of those conditions can be very common. In fact, DiGeorge syndrome is one of the most common things that we see in terms of microdeletion syndromes. So I think it's a great test to be able to offer patients who have some findings on ultrasound or some history that would put them at risk for that condition. I think the most devastating thing for an obstetrician would be to be at the time of delivery and deliver a baby that had a problem that we didn't know about ahead of time. It's obviously devastating for the family, and it's just as hard for us to have to break that news to them at the time that's supposed to be so joyous. So I think anytime we're able to diagnose a problem early in pregnancy and give the family time to plan, what you'll find is that most of them don't choose to go with an invasive test because NIPT, and namely Panorama, is such a great test.
My doctor had suggested that I consult a maternal fetal medicine specialist and have an amnio or CVS to determine risk, and I chose a less invasive, more innovative technology in Panorama. I work as a National Initiatives Coordinator for the largest women's healthcare company in the world, and I specialize in perinatal platforms. I am 37. I will be 38 when the baby is born. I have 2 children who are 15 and 10, a boy and a girl, and a wonderful husband who is very involved and is actually going to be the stay-at-home dad. I felt great about doing Panorama. I mean, the idea of being able to do a simple blood draw, which didn't bother me at all in comparison with having to do an amnio and have a needle stuck in my abdomen. It was really not a decision to make. It was a no-brainer. I think the results were great. I mean, within a week I had them back. It was so early on. I was 9.5 weeks when I had my blood draw, and a week later I had my results and felt a world better. I would highly recommend it. I mean, it's been a great experience. It gave us all of the information we needed with so little effort and so early on in the pregnancy, so that I could alleviate some of that anxiety that came along with just the worry of is this baby going to be healthy or not.
New testing, called non-invasive prenatal testing, or NIPT, was developed. This also is just a blood draw from the mother's arm. In this blood draw, instead of chemicals, we're actually looking for DNA that is created from the baby that then goes into the mother's bloodstream. NIPT allows for a higher detection of problems such as Down syndrome or trisomy 18, has a lower false positive rate, and does not carry the risks that you see with amnio or CVS, since it is just a blood draw.
NIPT is able to identify more chromosomal conditions than serum screening.
Panorama is the name of Natera's NIPT test. Panorama is available as early as 9 weeks in pregnancy, which is an entire week earlier than the other NIPT methods, which are not available until 10 weeks into the pregnancy. Panorama allows us to look for conditions like Down syndrome, trisomy 18, trisomy 13, various sex chromosome abnormalities. Panorama is also the only NIPT test that's able to look for triploidy.
Natera now offers a microdeletion screen as an optional add-on test to the Panorama chromosome aneuploidy screen.
Microdeletions are when there's a very small part of one particular chromosome that is missing or deleted. When there's a small portion of a chromosome that is deleted, there can be multiple genes within that small area of the chromosome. Depending on how big the microdeletion is, will determine the severity of the condition and outcome for the child.
All women are equally at risk for microdeletions on this screen, regardless of their age. They can affect as many as 1 in 1,000 live births. The microdeletion screen for Panorama includes microdeletions that, when combined together, are more common than chromosome conditions like trisomy 18 or trisomy 13, and have a range of intellectual disabilities and physical conditions.
These deletions can occur randomly in egg or sperm. They are usually not inherited and occur brand new in a child for the first time within a family.
These tests were developed by Natera, Inc., a laboratory certified under the Clinical Laboratory Improvement Amendments. These tests have not been cleared or approved by the U.S. Food and Drug Administration.